3. Here is another short video that demonstrates taking an accurate medication history when a medication list is not available.
Hi, Mrs. Smith. I'm Dr. Jones. I would like to go over your medications. Do you have a list on your pill bottles with you?
No, they're at home.
In that case, can you tell me what medications you take on a daily basis?
Sure, I take a high blood pressure medication, but I'm not sure about the name.
I am looking at medications from other organizations in your medical record, and I see that there's an outside provider that is prescribed lisinopril. Are you currently taking this medication?
Yeah, that is correct. And I also take a medication for my diabetes, and my doctor put me on a blood thinner 6 months ago when I had my heart attack. And I also take a cholesterol medication at night. I think that's it.
Okay, let me ask you about the medication you mentioned for diabetes. How many different ones do you take?
Just one. It is metformin. I take 2 pills in the morning and in the evening.
Do you know the strength of the metformin?
I think it is 500 milligrams.
Okay. Great. You also mentioned a blood thinner. Can you tell me the name of that?
It starts with P, but I cannot remember it.
Is it Plavix?
I am not sure.
I am looking at the dispense history and the medications from outside organizations, and there is an Adrian's Pharmacy that has dispensed Plavix in the last month. Does that sound familiar?
Yeah, that is the pharmacy I use, so I guess it is correct then.
I can call the pharmacy to verify the other medications. You also mentioned the medication for cholesterol. Do you know the name of that medication?
It is something with statin in the name. I was switched last month because my cholesterol was high and my doctor wanted me on something a little stronger.
I see there's Lipitor too that your pharmacy has dispensed in the last month. Does that sound familiar?
Yes, and I think that is 10 milligrams.
Okay, here's what I have so far. Lisinopril, metformin, Plavix, and Lipitor. I can verify the dosages in your dispense history, but your pharmacy can verify them too. Are there any medications that you're taking that I have not mentioned?
Yes, if you count an antibiotic that I was just given for a bladder infection, I'm almost done with it. It is Cipro. Does that count?
Yes, that is good to know. Let me run through a few other things I saw in your history. It says that you have asthma. Do you take anything for that?
Yes, I have an inhaler and I use it a couple of times a day. It is a steroid spray, but I cannot remember the name. I have albuterol, but I haven't used it in the last few months.
Do you take any medications from time to time only when you feel like you need them?
Yeah, I take Motrin and Tylenol for pain occasionally, but I haven't needed to take them in a long time.
Do you have any medications that you buy over the counter without a prescription?
Yeah, I take fish oil 1 gram every day, and that's it.
So let's review again what I have. I have lisinopril, metformin, Plavix, Lipitor, along with a steroid inhaler and albuterol as needed. Cipro for the last few days, Tylenol, Motrin, and fish oil.
Yeah, that seems to be the list. It is a lot.
Yes, it is a lot to remember. So in the last week, have you missed any doses in your medications?
I try not to, but I probably do here and there. It can be so confusing.
Okay. Well, thank you very much.
Thank you.